Hello, my name's Dr. Dave Eshom, and I'm a dentist in San Diego. And a lot of people ask me about Bioclear. Not just patients, but actual team members and doctors, because they want to know what is so special about Bioclear and how it can help them and how it can help their patients. And so I'm putting together this video today to inform not only just patients, but team members and doctors as to what Bioclear is and how it can benefit them in their practice. And so, today that's my goal, and we'll be going through different aspects and different slides for this to make sure that you understand the benefits of Bioclear and how it might be able to help you. So, on the first slide here is my team member, and you know, they have so much fun with this Bioclear method that they're not only telling our patients about it, but they're telling their friends, they're telling their family members how good this process is for them and how they can change their smile very conservatively with Bioclear. So let me go over some of the things that Bioclear corrects. One of the things it corrects is dark triangles. As you can see in this top left slide, this patient had this big black triangle between his teeth, and people actually told him that they thought that pepper was stuck between his teeth. And so he's so tired of hearing that he contacted us, and we did a Bioclear restoration on that tooth. You'll see it later restored. And on the bottom, it's the same thing. Lower front teeth, sometimes you'll get recession around your gums, and you'll end up with some triangles there that constantly pack food and constantly annoy you. Or you may have some teeth that have a space between them, and so you may want to correct that space. And in the past, you might have to grind on your teeth and do porcelain veneers in order to fix something like this. But with Bioclear, you don't have to do that, and you don't have to lose any tooth structure. And then on the far right there at the top, there's a tooth that is misshapen. We call it a peg lateral. And patients are born with this sometimes. And we intentionally left spaces there so that we can put the appropriate size tooth there. But now we don't have to grind on our teeth and place a porcelain veneer. We can do that with Bioclear also. And then on the last instance down there at the bottom right, you'll see this patient had straight teeth, nice teeth, but they're chipped and worn, along with some triangles, dark triangles between her teeth. And she just wanted her teeth rejuvenated. So we did that with Bioclear. But that's the kind of things that Bioclear can correct. But in the past, we didn't have that. And in the past, we used to try to do things like this with a method called bonding. And let me show you what happens with bonding and why we've stayed away from it in the past, but now have something better. In this instance, the teeth on the left, were done 4 years ago. And then these same teeth came into my practice, and now they're stained and they're chipped and they look unsightly. And this is one of the reasons why patients didn't like bonding, because they knew it was weak, they knew it would chip, and it knew it would stain. And so in the past, we'd have to grind on teeth and do porcelain veneers in order to correct this, but now we don't have to do it. Also, as a dentist, when you saw this bonding in patient's mouth, you would see these ledges under the gum. And the ledges were hard to floss. They would irritate the gum, then make the gum red and bleed easily. And so as a dentist, we didn't like that because the gum wasn't healthy. But with Bioclear, we can now get those areas healthy. And so also, when we're trying to fix things, we end up bumping into these ledges too. And so bonding really doesn't work very well, and it's been tried and tried and tried, but just never has come to its full potential because of ledging, and because it would stain, and because it would chip. So in the past, we would work with also these straight matrices, these little clear sheets of plastic. And what happened was, since they were straight, they would leave a straight edge on the teeth. And so we couldn't contour the tooth the way we wanted to without doing that same ledge that I showed you earlier. So back about 5 years ago, Dr. Clark started putting together a system that would conquer these problems. And it wasn't an easy thing for him to do. he had to find somewhere that would contour these clear matrices and make them the shape of teeth. And along with Dr. Kim, who's on the left there, they put together the Bioclear Learning Center and started teaching doctors how to do this. I attended the 3 seminars they have in Tacoma, Washington, and now I'm trained in Bioclear and do some of the most Bioclear procedures in San Diego. So let me tell you a little bit about the system. It comes with matrices, which are these clear, these little clear forms. It comes with a nice organized rack for the different forms. And then it comes, and what makes it really special is a heater. And so we heat the composite that we place around your tooth, and that allows us to inject it and do what we call warm injection molding. And so you need these things along with the training in order to perform Bioclear procedures. So you want to go to a doctor that knows what they're doing with Bioclear. And so the very unique features about the Bioclear system is that those matrices, those clear forms, are anatomically shaped. They're shaped like teeth, unlike those straight ones we used to have. When you do this system, there's no overhangs. You don't get those ledges, you don't get those irritated gums. You get a rounded emergence profile, meaning the tooth looks like it's round as it comes out of the gum, and that makes it look very natural. And then under the gum, you get this in what we call an infinity edge, which is like a knife edge that seals directly to your tooth with no ledging. The finish in between the teeth is exactly smooth because we're pressing and warm injecting against this mylar form. And then we use heated composite in order to get it into that position. And we use a warm injection molding technique. And then when this restoration is made, another big thing is it's what we call monolithic. Monolithic means it's all one piece. There's not these layers. And in bonding, we would layer the pieces in there as we would build your tooth. And that made for staining, and that made for weakness. Monolithic, meaning all one piece, makes it strong. And I'll show you how much stronger it is later on in my presentation. So here's the Bioclear method before. On the top left, you can see the ledges and the staining. And then on the bottom right, a case done by Dr. Clark that is perfectly smooth and looks just like natural tooth structure, has that emergence profile, has the naturalness, and has the ease in flossing with no ledges. So how do you get those infinity margins? We use these special matrices that I told you about that are curved like a tooth. And there's about 7 or 8 different matrices because we have some for front teeth in between, we have them for lower teeth in between, we have them on the back side of the tooth and on the front side of the tooth. So there's a lot of different combinations that Dr. Clark had to come up with in order to have these anatomically correct shaped teeth using these margins. And so in the picture there, you can see that there's ledge, and then on the bottom you can see what happens when you use Bioclear. It's a nice little knife edge that is perfectly smooth and perfectly curved and seals down at the gum line so you don't get those ledges. So I teased Dr. Clark, I know him pretty well, about how he came to invent the Bioclear ledges. And so what I tease him about is that at some point he must have seen the famous person Kim Kardashian. And Kim Kardashian is known for her hips. And Dr. Clark often teases about his matrices having these hips of Kim Kardashian. And so they're curved like someone's hips would be, so that we can get the same curve on your teeth. And so that makes your teeth not only look more beautiful, but they're also sexier. So here's some black triangle cases that I've done with Bioclear. You can see that one on the left there is on an upper front tooth and is unsightly, and then on the bottom there, after it's been done, you can hardly know it's done. And then on the right, we did that same case I showed you earlier of the lower teeth with dark triangles on both sides of that front tooth, and we corrected that and made it nice and smooth and natural looking, again without taking any tooth structure and without having to go through the cost of a porcelain veneer. So what this brings me to is a summary that Bioclear is not bonding. Bonding is a much weaker, distant relative to what Bioclear is. And it's because they have shape matrices, there's no prep on the teeth, they don't leave ledges, they're stronger, the method is warm injection molded, and so it's monolithic, it's all one piece, and it's strong. So let's go over how it works. We have to isolate your teeth so that they're nice and clean and that we can keep the moisture off them. Then we slide this little matrix between the teeth so that it forms that little seal, and it kind of makes for a aquarium around your tooth. And as we place these, we can place them both on bottom teeth and on top teeth, again using these Kim Kardashian curves to shape the tooth the way it should be shaped. And we come up with these great forms of natural looking teeth, perfectly curved, perfectly smooth, and perfectly natural looking, that are also strong. Now, in areas in the front where you get cavities, there's often, we had to use that straight clear matrix, and we would end up with a straight line on a tooth when we were trying to restore this as a dentist. But with these curved matrices, we can make the tooth look nice and natural, and that's what is so special about Bioclear. So Bioclear is also very strong. On your left is porcelain, and it's called Emax pressed, and that is the die-hard, that is the thing that almost all dentists use now for porcelain veneers. And on the right is called Lava Ultimate, and Lava Ultimate is made up of the same thing that we restore Bioclear teeth with. And so when we compare these two products, one is porcelain, one is composite, but this composite is very strong, Lava versus Emax, we test this, we find that that far right blue line is the same material that we use for Bioclear. And then on the left, you can see that the Lava Ultimate, this gray line, is actually somewhat weaker than the Lava Ultimate. And so from that we can conclude that our composite is almost or as strong as porcelain when done right. And then these are actually the measurements of those strengths. The compressive strength of millable porcelain is 370, millable composite is 380, so it's actually 10 megapascals stronger. Now at the very bottom there's this red line that says Bioclear restorations bond to more enamel than porcelain restorations. And that's absolutely true, because with a porcelain restoration you have to take more tooth structure away, so consequently there's less enamel. With Bioclear restorations we don't have to take hardly any tooth structure away, so they're being bonded to the strongest surface we can bond to, which is enamel. And so with that I surmise that these bondable Bioclear restorations are stronger than porcelain in some ways. So how strong is Bioclear compared to porcelain? I can take a case like this where someone basically has worn their tooth in half in the front and then rebuild them with Bioclear so that they will be strong and last a long time without having to grind any more of his tooth structure away, which he couldn't afford to have done, and still have a nice smile. So these materials that we use for Bioclear are very, very strong and very comparable to porcelain. So I feel confident, and the dentists that place Bioclear restorations are confident that they're strong. So again, the specialized equipment is the heater. The composite is heated to 158 degrees. Some people worry about whether that damages the composite. It absolutely doesn't, because they actually heat it up hotter when they're actually placing it in the little dispensers than what we do on the patient's teeth. So you don't have to worry about the heat being too much. Again, the specialized matrices that have curvature allow us to do that infinity margin. And then the best thing about Bioclear is that it saves tooth structure. On these cases on the left, I didn't have to take any tooth structure away. Cases in the middle, I didn't have to take any tooth structure away. Cases on the far right, I was able to get those results you saw earlier without having to take any tooth structure away. So when we put these two together, on the bottom is how much tooth structure would need to be removed for porcelain veneers to be placed. And on the top, there were some old fillings on these teeth, and that's the preparation. No other tooth structure was touched to get what the Bioclear veneers give us, which is basically almost a veneer that looks like porcelain. So again, very little tooth structure and very conservative, and later on we'll talk about cost. So how is Bioclear done? Again, it's done in a very specialized way that makes it strong and makes it conservative. So we have to use these 4 things here. We have to remove all the biofilm, the plaque, the dirt off someone's teeth. We have to use that anatomic matrix that we've talked about so much. We have to use injection and heated composite and injection molding, and then we use this materials made by Bioclear for that Rockstar polish we talked about. So here's some biofilm placed on a tooth, and we actually stained it to make it more visible. And then we use these materials here to clean it off before we place the Bioclear restorations. It looks like this after we're done. Very, very clean and very, very bondable, especially. We place the matrices around the teeth, make that little aquarium. We pick the right matrices to use. There's all the different ones that we need for the different situations. We use heated composite. And then when we inject it, we get this big over-contoured monolithic restoration. So again, monolithic means all one piece because it's been injected and cured, all as one piece. And then we have to use our dental artistic ability to make it look like a tooth. So here's what that looks like in video. So the matrix is being placed both on the front and the back side of the tooth. The little aquarium is made. We prepare the tooth with our bonding and our adhesive technique. We get the tooth etched. That's that blue. We rinse that off. Then we'll be placing our adhesive liquids so that we bond around the root and we bond the enamel. We thin that and dry it as we need to. And then now we're injecting flowable composite material down into those little triangular areas with heated composite. And then we take this paste composite that's also been heated and we push that material out. We actually want to try to replace all that flowable material, and we do it from both the front side and the back side of the tooth. And then we contour the tooth slightly before we shine a light on it to cure it and turn it into that, again, one-piece monolithic restoration. After that, we remove our matrices, and then we'll start the artistic work by contouring the tooth to make sure it fits your bite and make sure it looks just like a natural tooth. So that's kind of what the Bioclear method is with the warm injection molding, sped up, but gives you an idea of why this method and these materials are so special. So when you think about these monolithic restorations, these big pieces, I think about some of these guys that collect athletic shoes. And so these guys that collect athletic shoes, they buy these expensive shoes, the Jordans, what are those other ones? I forget, Kim Kardashian's husband has some shoes. But they buy these shoes and then they wrap them with clear wrap, and then they take this hair dryer and they shine that hair dryer on it until it shrinks that material around their shoes. And so it shrinks wraps and protects these shoes, because as they show them their friends, they don't want greasy hands on them and them to get dirty, because then they'll lose their collective value. So that's what I think about with Bioclear, is that this composite that we're placing on the tooth is hugging that tooth in 360 degrees in all directions. And so when it cures, it's hugging, it's tight, and it's strong. And so we can really depend on it to last through all the chewing cycles that we put our teeth through, just eating and chewing every day. So here's the Rockstar polish. It's very easy. There's only two main components to it, but it gets this shiny surface that is stain resistant on our restorations. And to show you quickly what the Rockstar polish looks like, you start with what they call the magic mix. And you go around and polish the tooth and get it to a nice kind of a satin finish, or a matte finish, I should say. And then after this, you'll go through and use the polishing cup, and then that will get it to the nice satin finish that is actually probably shinier than your natural teeth. You're wanting to get it all into the nooks and crannies and make sure that is nice and smooth and doesn't collect any plaque and is easy to clean for the patient. So the cornerstones for the Bioclear method are removal of the plaque, nice clean tooth structure to use our adhesive materials against, use that anatomic matrix, use warm injection molding, and then get to that Rockstar polish so that it looks like a natural tooth and then resisted stain. So that's kind of what and how you do the Bioclear method. But the last piece is very important, in that you need to be able to be educated about this. And I went through the system of 3 different weekend training sessions up in Tacoma with Dr. Clark and Dr. Kim at the Bioclear Learning Center. And you just can't do this by buying the materials and trying to figure out yourself. I know there's these dentists out here that try to do it themselves, but I tried it. It didn't work for me. I needed to go up there because there's some intricacies of how you do all this. And it's important that it's done correctly in order for it to last. So you want to look for a Bioclear doctor that has been trained. So back to summarize, Bioclear is not bonding. Just like a rotary telephone isn't like the cell phones we have today. This straight matrix in the middle there is not the same as our curved anatomic matrices. Using the warm injection molding, using the Rockstar polish, and getting that education makes it very, very different than bonding. And so Bioclear is much better than bonding. So, how do we explain this to patients? First, we would explain it to our dental team by saying unique matrices, unique technique, warm injection, monolithically strong, use the Rockstar polish, the doctor's been educated well, so that the dental team feels good about suggesting this to your patients. Then we need to go over what the benefit to the patient is. And there's all these problems that you see on the left, the black triangles, gaps, food traps, crooked teeth. And then all those problems are solved with the Bioclear method. It's an alternative to having to do both expensive porcelain veneers and extensive tooth structure removal that you need to do for porcelain veneers, so it's better for the patient that way. It costs less than porcelain veneers, so it's better for the patient that way. The treatment is completed in 1 day. You don't have to come back in 2 or 3 weeks like you do with porcelain veneers. There's very little tooth structure removed. It lasts a long time. It's stronger than bonding. It's almost as strong as porcelain veneers. It looks just like natural teeth when it's being done by someone who's been trained, and it's also very safe for your gums. So for patients, there's this huge benefit. And that's one of the reasons why we offer it so much in our office, is because we want to do what's best for patients and their teeth. And Bioclear is best for patients and their teeth in the applicable situations, which are immense. So let's talk about insurance and Bioclear. Insurance doesn't cover Bioclear. It might cover a small portion, but this is something that is beyond your insurance coverage. So you have to see and understand the value of Bioclear and see how much better it is for your tooth, even though you may have to pay for it out of pocket. And both the team members and the doctor need to understand that the way insurance companies pay for bonding is so much less than what Bioclear is, that you can't possibly be doing Bioclear for what the insurance would pay for a composite. So sure, we bill our patients insurance for some of this, and it may pay a small portion, but the patient needs to understand that what they need to do what's best for them rather than what is covered for their insurance. And with all that I've explained today, you have to understand that Bioclear is much better for your teeth and will serve you much better, even though there may be more out-of-pocket costs. So I kind of explain it like this. On the bonding, you can see the bonding on the left and how it's stained after 3 or 4 years. You can see what the diastema closure looks on the right, how smooth it is and how natural looking it is. Well, you can either eat at McDonald's and have a cheap meal that may not be healthy for you, or you may go to Whole Foods Market where the food is healthy. They think about what's good for you long term, and you'll be better long term for it. So with Bioclear, you're better long term for it. It's not junk food like McDonald's, and it's not junk like bonding. So think about that when you choose your dentist for Bioclear, because you need somebody that is going to provide quality for you, take the time for you, went through the education for you, and gives you the result that you deserve. So here are all those Bioclear cases that I've done, and all of them I've done without having to touch tooth structure. And that's probably the thing that patients pay the most for, is when they do a veneer or when they do bonding, is they pay with their tooth structure that can never come back. With Bioclear, you take little or no tooth structure away, and you'll always have that, and hopefully you'll have it for your lifetime. So it's better for you from a health standpoint, and it's better for you from an appearance standpoint. So anyways, if that's my story about Bioclear, I hope you understand the value of it, and I hope you can not only spread it to your patients, but spread it to the people outside the office so they can see the benefits of it and look for that Bioclear doctor so that they can help you with the best method possible today. Thank you very much for listening to me today.